Hello. Are you familiar with this situation? In the morning, you measure your blood pressure and see 150, 160, sometimes 170 millimeters of mercury, but an hour passes and it's already 125 by 80. And then you relax and think, well, if my blood pressure is normal during the day, there's nothing to worry about. But that's not true. Unfortunately, this is a common mistake, reassuring yourself with daytime numbers. Because blood pressure is not a single reading at one moment in time, it's a profile over the course of a day. And for some people, the most unfavorable period is precisely the night and morning. This is no joke, it's one of the most dangerous conditions. Today, we'll look at 3 types of morning peaks. I'll give you a clear action plan to distinguish a threatening condition from a harmless one, and what to do with all of this afterward, of course. So, high blood pressure in the morning. Often, this is not the same hypertension that just happens to be worse in the morning. Sometimes it's a completely different mechanism. Sometimes it's the tail end of a nighttime problem. And if you only measure your blood pressure during the day, you may develop an illusion of control. Your daytime pressure looks normal, yet your overall profile may remain poor. So what is a profile? It's simply your blood pressure over the course of a day and across multiple days. Individual readings are noise. A profile is already a system. It's already information. Now, 3 possible scenarios. The first is the most harmless. You're simply measuring incorrectly and creating hypertension for yourself. The second is a genuine, pronounced morning blood pressure surge. Pressure really spikes in the morning while looking acceptable during the day. The third is the most unfavorable. At night, blood pressure doesn't drop as it should, or it may even rise. And in the morning, you're only seeing the consequences of the night. We call these people non-dippers. This is a profile in which blood pressure doesn't achieve its normal nighttime reduction. In healthy individuals, blood pressure is lower at night than during the day. This is called a dipper profile. Normally, nighttime pressure drops by approximately 10 to 20% compared to daytime levels. In non-dippers, this drop is absent or too small. Why is this unfavorable? Because the body doesn't get a nighttime rest. The heart and blood vessels work under load all night long. Imagine that under normal conditions, your cardiovascular system gets to rest, but for a non-dipper, that rest never comes. Do you think this extends your body's resources or wears them out instead? And often, this means the risk and strain are higher than your daytime numbers suggest. Sometimes it's even worse, when nighttime pressure doesn't just fail to fall but actually rises. Both the non-dipper profile and the situation where pressure increases at night are associated with elevated risk. For example, a 20 millimeter rise in nighttime blood pressure is linked to a 40 to 50% increased risk of stroke and a 30% increased risk of cardiovascular complications. What's more, this affects roughly 1 in 4 people, and many of them have no idea they're on the edge of a serious event.
Now let's work out how to tell these scenarios apart. The first thing we need to do is rule out the most common issue: measurement errors. In the morning, people are often getting ready for work, feeding children, having coffee, or smoking. So the most frequent mistake is measuring your blood pressure immediately, without any pause. But the heart is a pump that circulates blood according to the body's needs. A moment ago, your needs were high, so your blood pressure was high too, and that's perfectly normal. A rise in pressure during activity can be compared to the pressure in a water pipe when water needs to be pushed up to the 10th floor. When you're at rest, the water only needs to reach the 1st floor. The heart and vessels can't adjust instantaneously. They need at least 5 minutes of calm sitting. For some people, even 1 cup of coffee affects their blood pressure. So stop drinking coffee at least 30 minutes before measuring your blood pressure in the morning. The next mistake is a full bladder, which genuinely raises blood pressure. Some people spend years treating hypertension that was caused by nothing more than a full bladder. Mistake number 4 involves the cuff and your posture. A cuff that's too small, an arm held below heart level, measuring over clothing or crossed legs, all of these lead to inaccurate readings. By the way, it's worth reading the instructions for your blood pressure monitor. All of this is explained clearly there. Eliminate all these factors and you'll get an accurate picture. take two measurements 1 minute apart. Record the average. It's also important to find out which arm gives a higher reading, and always use that arm. If you've measured correctly every morning for 7 days and the numbers are normal, you can put your mind at rest. But if you've done everything right and your pressure is still elevated and keeps repeating, there may be two causes. One of them is a genuine, pronounced morning surge. Most people experience a slight rise in the morning. That's normal. But in some people, this rise is too sharp, and the numbers can be alarming. Many people miss this because they only measure during the day. But again, a diagnosis is not based on isolated individual readings. It's based on a 24-hour profile. This cannot be left unaddressed. And finally, the third and most dangerous scenario: nighttime blood pressure doesn't fall, or actually rises. This is precisely the non-dipper profile. Remember this. That's exactly why you see high readings in the morning. You're looking at the tail end of a nighttime problem. What's most commonly behind it? One of the most frequent causes is obstructive sleep apnea, a breathing disorder. The person snores, experiences pauses in breathing, sleep becomes fragmented, and the body receives microstress every single night. Blood pressure at night can behave in a very unfavorable way. Snoring on its own is of course not a diagnosis, but if you notice morning blood pressure peaks, plus snoring, plus pronounced daytime sleepiness, plus morning headaches, plus the feeling of "I slept but didn't rest," that's already a reason to think in this direction and investigate. But there are other causes of nighttime blood pressure elevation as well. Alcohol in the evening, late heavy meals, excess weight, chronic pain, chronic stress, stimulants, and certain medications. The principle is the same. If the problem is nocturnal, daytime measurements may look perfectly acceptable, creating the illusion that everything is fine.
So what can you do at home? The most important thing is a 7-day blood pressure profile. Once we've confirmed that the morning surge is real, we move to the second stage, assessing the daily profile in the morning, afternoon, and evening, following all the rules. Each time, take two readings 1 minute apart, record the average, and keep a diary. It's generally recommended to discard the first day's readings, then calculate the averages for the remaining days. If pressure is consistently high in the morning but consistently normal in the evening, this is more likely a morning surge or the residual effect of nighttime elevation. If pressure is high morning, afternoon, and evening, the picture is obvious. And if pressure is high at the doctor's office but normal at home, that's a separate issue, white coat syndrome. And once more, why is the diary important? Because a single reading is noise, but a trend is a signal. Please remember that. So after 7 days, you have a clear picture, but there's an important limitation to this approach. A home diary is almost blind to the night. That's where 24-hour ambulatory blood pressure monitoring comes in. This is a special cuff with a monitor worn on the arm that measures blood pressure at programmed intervals throughout the day. For example, every 15 minutes during the day and every 30 minutes at night. The goal is to see the blood pressure profile at any moment, during sleep, rest, work, or stress. Without this, it's hard to understand how and what needs to be treated. However, despite its value, 24-hour monitoring has its limitations too. Sometimes it's necessary to track the trend over 7 or more days, which is important, for example, when adjusting blood pressure medications. The cuff, as anyone who has worn one knows, is often uncomfortable and can disrupt sleep in some people, so the method is not perfect. Today, we have medical systems that can be worn for extended periods, weeks, months, even a year, giving a view of real life, sleep, stress, physical load, breathing, and recovery. For blood pressure specifically, these are not yet a replacement for the cuff monitor. They provide supplementary data and trends that help the physician build a more complete picture. One such system is the Corsana CardioWatch. In the European Union, it is a certified medical device with CE marking under EU MDR requirements. In the United States, the system has completed the FDA 510(k) clearance process. I want to clarify, for arterial blood pressure, Corsana is not yet a full replacement for 24-hour ambulatory monitoring and does not replace cuff measurements. Blood pressure decisions are confirmed with a tonometer. The value of Corsana lies in helping identify trends and understand on which days and in connection with what factors the readings change. Plus, it provides regular weekly reports and a great deal of useful clinical information for an individualized health monitoring and optimization program. Now let's talk about medications. The most common mistake is chasing your blood pressure, acting reactively. You measure, the reading is normal, so you skip your pill. Then you measure again, see 200/100, and rush to take a tablet. This is a very bad habit. You're allowing your blood pressure to damage your health for hours at a time, day after day, month after month. The goal is to prevent the rise from happening in the first place. That's exactly what the 24-hour profile is for. It allows you to pinpoint the exact time to take your medication. To be clear, the timing depends on the specific drug and on your own profile, and the schedule cannot be changed on your own. This is decided together with your doctor based on diary data or monitoring results. To illustrate how this works in practice, if your pressure peaks in the morning, it may make sense to try taking your medication before bed. If it peaks during the day, taking it in the morning may be more effective. If it peaks in the evening, taking it during the day may be the answer. In short, prevent, don't chase. And now the final algorithm. What to do if you have morning blood pressure peaks. Step 1. Master proper technique. Follow the protocol and you'll find out whether you've been creating hypertension yourself. Step 2. Build a home profile over 7 days, morning, afternoon, and evening, a minimum of 2 measurements each time. Take the average and keep a diary. Step 3. If the peaks keep recurring with correct technique, it makes sense to proceed with 24-hour ambulatory blood pressure monitoring because you need to see what happens at night and determine whether you're a dipper or a non-dipper. Step 4. If the profile shows a non-dipper pattern or nighttime peaks, investigate the cause of the nighttime profile, starting with sleep-disordered breathing, weight, alcohol, late meals, pain, stress, or stimulants. Then build a proactive treatment plan together with your doctor. Step 5. In parallel, start building a non-pharmacological foundation. The sooner, the better. This includes weight loss, if needed, physical activity, diet, sleep, potassium and magnesium where there is a reason for them, dietary nitrates from food, garlic, and sometimes taurine. None of this cancels out medication when it's needed, but it strengthens control and can sometimes produce very good results, especially when started early enough. Sometimes it's actually possible to come off medications entirely. For example, losing 10 kilograms often results in a drop of about 10 mmHg. Or isometric exercise, a wall sit, produces on average a sustained reduction in systolic pressure of around 8 mmHg. There are many videos about hypertension on this channel. Subscribe and hit the bell so you don't miss the next one. Thank you for watching, and here's to your good health. Goodbye.